All right, let's dive right in. We're going to be talking about the incredible world of pediatric nursing. And you'll see pretty quickly that this is so much more than just a job. It's a specialty that really demands a unique mix of science, art, and a whole lot of heart. So if you're ready to find out what truly sets this field apart, let's do it.
Okay, so let's just start with the biggest question, the one that really shapes everything we're about to talk about. Are children just little adults? I mean, it seems like a simple enough question, right? But believe me, the answer to this one question defines the entire practice of pediatric nursing.
And the answer is a resounding absolute no. And this single truth, it shapes every single aspect of pediatric care. Think about it. A child's body, their needs, their emotional world, it's all in a constant state of flux. It's completely different from an adult's. This idea is literally the foundation for everything we do.
So what is pediatric nursing then? Well, let me tell you, it's about way more than just using smaller needles or figuring out smaller medication doses.
Okay, let's break this down because the differences are huge. In adult care, your patient tells you what's wrong. In peds, the caregiver is your essential partner. They know that kid better than anyone. And physiology, it's a whole different ballgame. An adult's body is pretty stable, right? But a child's is constantly changing. A newborn's heart rate of 140 is totally fine. But if you saw that in a teenager, whoa, major red flag. You're not just treating a disease, you're monitoring growth and development. And consent, it's not just a signature on a form, it's this complex dance of consent, permission, and assent. It's a completely different world.
You know, this idea of partnering with the family, it feels like common sense now, but it's actually a pretty recent development. It was a total revolution in thinking, a huge shift from basically excluding parents to making them the center of the care team.
It's actually kind of hard to believe, but if you go back in time, pediatric hospitals were these cold, sterile places. The #1 goal was stopping the spread of infection. And to do that, they thought parents were a risk. So parents often weren't even allowed to visit. Their input was seen as a nuisance, and the child's emotional needs, they weren't even on the radar. It's a completely different picture from what we see today.
And then, thankfully, the research started to come out, and it showed pretty overwhelmingly the incredibly negative impact of separating kids from their parents. That was the spark. It started a revolution that led to what we now call family-centered care. Today, we know that families aren't a detriment. They are absolutely essential partners. Their knowledge of their own child is something we just can't do without.
So how does this play out in the real world? Well, it's kind of built into 3 core models. First, you've got family-centered care that's all about dignity, respect, and treating the family as the experts. Then there's relationship-based care, which, just like it sounds, is all about building that trust between the nurse and the family. And finally, the pediatric medical home, which is about making sure care is seamless, from the hospital all the way to home and into the community. But look, they all share the same core belief. The family is the absolute anchor.
All right, so we've got the philosophy down. Now let's open up the toolkit. What are the actual hands-on skills you need to have to care for these unique little patients?
Well, right at the top of that list is communication. But here's the thing. You absolutely cannot talk to a 2-year-old the same way you talk to a 16-year-old. It just doesn't work. Your approach has to change with every single age and stage.
And you can see that right here. With an infant, it's all about your tone of voice, being soothing, responding to their needs. But with a toddler or preschooler, you have to be super literal. They take everything you say at face value. So you'd never say, "I'm going to give you a shot," because they might literally think you have a gun. You say, "a little poke," or some medicine under your skin. See the difference? Then for a school-age kid, it's about being honest and letting them participate. And for teenagers, it's all about privacy, respect, and asking open-ended questions.
So this leads to a classic peds puzzle, right? How in the world do you figure out if a baby is in pain? I mean, they can't tell you. They can't point to one of those smiley face pain scales and say, "I'm a number 6." So what do you do?
While the answer is you become a detective, you use observational tools. And one of the most common is the FALC scale. It's an acronym. You look at their face. Is it calm or is it grimacing? You look at their legs. Are they relaxed or are they kicking intense? You check their activity, their cry, and their consolability. Can you calm them down? You score each one, and it gives you an objective number for their pain level. It's an amazing tool that lets us assess pain even when a child is totally nonverbal.
Okay, so we've got the fundamentals, but the world of child health is not static. It is constantly changing. And that means pediatric nurses today are facing a whole new set of challenges.
And here are some of the big ones. We are seeing a massive increase in the need for mental health services for kids. There's also a big uptick in chronic illnesses that we used to think of as adult problems, like obesity and type 2 diabetes, but they're showing up more and more in kids.
And we're even seeing puberty starting earlier, which brings a whole host of physical and emotional issues to the table for younger kids.
And it's not just the health trends. There are these huge system-wide challenges too. We're facing a nursing shortage. We're dealing with more complex family dynamics than ever before. Divorce, foster care, you name it. And on top of all that, you're navigating things like insurance barriers and making sure the care you provide is truly culturally competent for every single family you meet.
All right, we're going to shift gears now to what is, without a doubt, the most difficult part of this job. We're talking about ethics, and we're talking about end-of-life care. This is where the stakes are as high as they get.
When it comes to making medical decisions for kids, it's not straightforward. There are 3 different layers you have to understand. So first, there's consent. That's the legal green light from a parent or guardian. But then you have assent. This is where you ask the child for their agreement, usually once they're around 7 or so. And here's the crucial part. They can say no. They can dissent. Their voice matters. And finally, there's permission. This is the moment-to-moment stuff, the simple act of respect, asking, hey, is it okay if I take your blood pressure now? It's a constant dialogue.
The guiding principle for all of this is what's called the best interest standard. But, that sounds simple on paper. What happens when the doctor thinks one thing is best, the parents think something else, and the child wants something different entirely? That's when things get really, really complicated.
And there's another huge ethical duty we have to talk about, the role of the nurse as a mandatory reporter. This is a legal requirement. If you suspect a child is being harmed or neglected in any way, you are legally obligated to report it. It is an immense responsibility, and it's one of the heaviest parts of the job.
And sometimes, despite everyone's best efforts, a cure just isn't possible. And when that happens, the goal of care has to shift. We're no longer focused on extending life. The focus becomes ensuring a peaceful, dignified, and comfortable death. It's about quality of life, not quantity. And this is where a compassionate, team-based approach involving the whole family is just absolutely critical.
So when you boil it all down, being a pediatric nurse means you're not just caring for a patient. You're caring for a child, for their parents, for their siblings. You're caring for their entire world. You're with them through the good times, the scary times, and sometimes the most heartbreaking times imaginable. So the final question is really for you. How will you rise to that challenge?